Let's talk about the bowel here on this abdominal X-ray. Here we have uh, AP abdominal radiograph. Okay, and this mostly what we're seeing here on this view is air in the colon. Okay, and we're going to talk specifically more about the bowel wall. This patient. If you look here at the colon, see air here. Here you can see this is the bowel wall. It's thin. It's like a couple, it's like a millimeter, a couple millimeters in thickness. You can see it laterally. Okay. This density right here represents the outer margin of the bowel wall. The reason we can see that is because there's fat on the outer margin of the bowel wall here and air in the lumen. Okay. So if you window the X-ray down to detect differences between soft tissue attenuation and fat, you'll be able to visualize the bowel wall. If I zoom in a bit more here, find another example. Here you can see this is the transverse colon, okay? And here you can see the bowel wall like this. It's, again, a couple millimeters in thickness, okay? It's outlined by fat, it's outer margin, luminous air, so that's why you're able to see it, okay? Here you can see the outline of the wall of the stomach, okay? The greater curvature stomach, okay? Um, Lesser curvature is outlined here. Okay, and one thing I can point out anatomically, um, whenever if you're looking to find the transverse colon, one thing is to find the stomach. Okay, immediately below the stomach, you'll be able to find the transverse colon. The reason for that is because there is a gastrocolic ligament, okay, which attaches the inferior margin of the stomach to the transverse colon. Okay, so if you're having difficulty finding the transverse colon, look for the stomach, look for its inferior margin, look directly below that. What else can we see here? Another structure we can see here are the psoas muscles coming down like this and like this. Again, we see that outlined laterally by fat.